health is not merely the absence of disease, but a sense of physical, social, and mental well-being.
Equitable access to health means health for everyone.
The outcome of a disease is being only determined by the disease itself.
Those who are more disadvantaged need to get more to pull them up.
I think it's one of the most unfair things that one can ever go through, where I'm born with a genetic disorder, I deserve to die. All my life, I always wanted 2 kids. And I told myself, I'll get 2 children, regardless of whether they are male, female, I didn't care. When my son was born, he presented some symptoms which were not making sense. He was jaundiced, and he was also very weak. So we took him to hospital, and the doctors also realized that he was anemic. At that point is when one doctor came in and she asked for sickle cell test. And that was the beginning of the journey.
We have challenges because if you look at the number of babies that are born with sickle cell across the world, you have more than 70% of them being in the sub-Saharan Africa, and this is a great burden to us.
When you were given that diagnosis, what were you thinking?
Death. I was scared. I remember holding my son in my hands and I started crying. Most of the time the conversations would be somebody living with sickle cell anemia would never live to see a certain age. And that was what hit me first.
In a sense, that the inequity that has affected people with sickle cell disease is an example of the broader inequity that affects people who do not have the resources or who are unfortunate to live in places where resources are strained.
Really, the challenge in sub-Saharan Africa is that the health systems are weak and there is no coherent plan to strengthen the health system in a coordinated manner.
I think for many years in global health, we have brought solutions into countries without developing a framework in which they could flourish. When we were looking at countries where we could make a first start, Ghana came to mind for a number of reasons. There was a good environment and a willingness, a political will to make a difference.
Working with the Sickle Cell Foundation of Ghana in collaboration with the Ministry of Health, Novartis put together a public-private partnership to address sickle cell disease holistically.
The ambition was the government of Ghana would come to the realization of the burden of sickle cell disease in the country, be able to prioritize that, and be able to ensure at the end of the project's life that the hydroxyurea would be taken on as a reimbursable drug.
We were also working with, for instance, local universities to develop treatment guidelines. We were putting in place a monitoring and evaluation framework.
Which kind of personnel do you have to have? Which kind of laboratory resources should you have? Which kind of clinical intervention should you be able to deliver? It is all part of the whole health system strengthening strategy.
When we signed the Memorandum of Understanding, our hope was to see improvement in the quality of lives of sicklers, improvement in capacity building.
The ambition of our program is to provide access to comprehensive management of sickle cell disease for patients who need it, where the burden of disease is.
In order to bring other stakeholders along, we made some catalytic investments, but we also actively lobbied, for instance, other private sector players to join the program on the diagnostic front, on the data management front, in order to make a bigger impact.
In sub-Saharan Africa, PerkinElmer's aim is to support and increase capacity for sickle cell newborn screening. I think What has brought us together is that we share the same common goal, and we can improve the advocacy effort in sub-Saharan Africa.
We realized that Novartis was operating in several of the countries where Konza is operating, and so that offered a very natural opportunity for collaboration to reach all these people who sometimes live remotely from major urban centers. It requires a lot of resources, and so Novartis has been helpful with accessing the required resources and also provide the materials that are required to educate the healthcare providers.
When my kid got sickle cell anemia and was diagnosed of it, it left me curious, wondering what's this disease, how does it present, what is it that we did wrong? So as I walked into Children's Sickle Cell Foundation, that was the beginning of learning of everything about sickle cell and where the gaps are. One of the things I couldn't believe was meeting other people living with sickle cell. Through that, I got interest in learning more about sickle cell disease, and over time, I then ended up becoming a sickle cell advocate.
So this whole concept was actually a co-creation idea. It was a collaboration between Novartis and those of us at Sickle and the Navrongo Health Research Center. It was a real collaborative effort to create a program that will address the core issues that we wanted to address, that is integration into primary care.
Local research is extremely important because people believe in their own people.
When you think about the number of patients who've been identified in the study, I think that really highlights the power of partnership. The health system that you have in the local area is now being strengthened through this partnership.
Now I'm doing well, my son is stable, but then every time I meet somebody with sickle cell, they are in tears. Somebody is in so much pain. I'm thinking to myself, how can we help? The partnership with Baraka started because we wanted to just simply change the lives of people living with sickle cell. It was as simple as that. But our role is very clear. Baraka is doing the clinical care. Children's Sickle Cell Foundation is doing the social part of it.
We must ensure that we focus on the entire patient's social, psychological, physical, and spiritual well-being.
As we are working with Baraka in partnership, we are also happy that there are organizations that are coming to us like Novartis, who are calling on to us like, where can we help? Baraka has come in to give people their dignity back. And whenever I look at it, I keep on saying, this is where you get your dignity.
I believe that the time has come for us to see sickle cell disease as something that requires multiple stakeholder collaboration and partnership.
The strength in partnerships is that you are working together for a common cause and a common goal.
Anytime we work on strengthening the response to a disease, we are indeed strengthening the whole healthcare system. We will indeed create resources and create expertise that can then be allocated to other diseases as well.
We have seen tremendous scientific progress in medicines that can cure, attenuate, modify diseases. But in order to bring this benefit to all patients, we need to make sure that the health systems can maximize that inherent benefit of those innovations.
It is only through such an effort that we can vastly change the landscape of sickle cell disease.
No man can live in an island. And that's what we realized with the management of sickle cell. As the gap comes up, who then do you call upon to fill the gap? I think it's about holding hands And if we hold hands, the circle is bigger and we are able to achieve more.